The microscope changed our perceptions of the world, making the invisible world visible. In doing so, it made our view of blood more personal, as we developed a subjective and universal understanding of this life-giving substance. Throughout history, images such as this one depicted soldiers as they bandaged their wounded, but we view it distantly as a historical passage. It is clearly a different time and place. Even as we visibly view the emotional anguish as a surgeon tries to stop the bleeding of a patient, we are still yet an objective bystander. This detailed drawing of the circulation of the human body, though, is perceived more subjective, as there is no distinguishable face. Further drawings of isolated body parts engage the reader even further. Scott McCloud explains this concept as closure, where the viewer must participate more, using his imagination to perceive the whole body, forcing one to use deductive reasoning. Viewing a blood transfusion from animal to human provokes the imagination, but it is, as one would view, an oddity. Or an amusement, as Napoleon receives an infusion of tiger blood. But what medicines help stop bleeding? This poster, using iconic imagery, commands our personal attention, creating a subjective reaction in its simplicity, asking us to take personal ownership for understanding its directive. 18th century medical literature spoke of linen soaked in blue vitriol waters to stop the bleeding and healing of wounds. But what were these waters? It turns out that would require seeing the unseen to understand why. The salts were copper sulfates, a magical blue substance, but the microscope allowed us to peer deeper into a new world of understanding. As this new tool magnified blood, we gained a new understanding of the individual blood cells, platelets, and microbes. Copper sulfate, it appears, had an antibacterial property that promoted wound healing. This is an image of a bloody bandage. Simple and abstract in its magnification, it creates an iconic image, one in which we can place ourselves and identify with. It becomes a subjective view of what could be our own blood. We use this new understanding and perception to view wound care differently, into how and why bandages were applied with blue vitriol waters and why they helped in wounds. Band-aids with sulfathiazole, a derivative of copper sulfate, were created as a more effective bandage. Nowadays, our understandings of body, both what is visible and invisible, has changed our perceptions and has made us feel safer. We bound into unknown waters, as seen here, confident we will develop new ways of seeing the world that will protect us in the future.